What made you shift gears to fertility medicine?
A couple who's childless is not treated the same way, at least 10 years ago, not the same way as they would treat a couple with children.
It's true.
So, how could we make a difference there was one of the questions which paved way into reproductive medicine.
How long does an IVF treatment typically take?
Each couple come for the fertility treatment for different reasons. There could be a single reason or there could be more than one reasons which are leading to the subfertility. So it's important for us to ponder what is the reason, and if it is a single reason or a reversible cause, then the time towards success or having a baby or begetting a baby is going to be very, very short.
What precautions do you advise after embryo transfer?
There are even questions which says, can I eat this vegetable? Can I eat this particular fruit? Will that harm me? Will that harm the baby? First thing, avoid anxiety. Please be normal. Because it's not what you are going to do. It's what the nature is supposed to be doing to you after all these medical treatments.
Hello listeners and welcome back to Fertility Tales powered by Nova IVF. I'm your host Simrat and I hope you're as excited as I am for today's episode. We're delving into the fascinating world of fertility medicine, and joining me is a true trailblazer in the field. Dr. Madhupriya, a gold medalist from Thanjavur Medical College, is an expert in obstetrics, gynaecology and reproductive medicine, holding member of the Royal College of Obstetricians and Gynecologists and a super specialization from Chennai. With over 20 years of experience, she has made significant contributions to fertility treatments, androfertility and oncofertility, and is a dedicated advocate of women's health through public awareness and education initiatives. The list goes on. Dr. Madhupriya, it's a pleasure to have you with us today. You've been in the field for over 2 decades now, and I'm sure our listeners are very eager to hear about your incredible journey. How did it begin? What made you shift gears to fertility medicine?
So, I hail from a place called Tiruchirappalli in South Tamil Nadu.
Okay.
And I did my schooling there and then went off to Thanjavur Medical College, which is one of the renowned medical colleges in Tamil Nadu.
Yeah, it is.
And thanks to the faculties there, the professors there, in each department, right from the anatomy to until medicine, all of them had given us some good thoughts to make us not only good doctor, but also a very good human. To have empathy, to have sympathy, to work with people, to give them whatever best we can.
That's true.
So after that, I did my post-graduation at Chennai, Apollo Hospitals. And I had tasted a bit of all the subspecialty in obstetrics, gynecology before I chose fertility medicine. I had been to laparoscopy training. In fact, I had done a little bit of a fetal medicine, a little bit of an ultrasound.
Wow.
And beyond all this, high-risk obstetrics too. But once I had a taste of infertility or fertility medicine, that way I would put it as, I was very happy that I was able to help beyond being gynecology specialized in obs and gynae. I was able to do a little better in this subspecialty because here, traditionally and culturally, people think having a baby is a boon. A couple who's childless is not treated the same way, at least 10 years ago, not the same way as they would treat a couple with children.
It's true.
So how could we make a difference there was one of the questions which paved way into reproductive medicine.
All right. So it was like you took all your experience and then got it to reproductive medicine.
Yes, I think this favored me too much.
That's amazing. That's a fulfilling reason also to specialize in fertility. You've seen the landscape of fertility that has changed over the years, with you itself being in the field for about 20 years plus. What do you think was the prevalence of fertility issues 20 years ago? And have you seen the complexity of these issues evolve over time? Has infertility, it has increased over the due time, but what is the complexity of these issues?
Right. To put it straight, I have been here. This is my 10th year that I'm finishing at Nova IVF Fertility. And a decade earlier, the kind of factors that existed are the same that are existing now. But a few changes that I could see is the incidence is more, the prevalence is more, but there is an open mindedness as far as the couple are concerned. And people are aware of the reproductive health and they consider this more as a science rather than as culture alone.
That's important.
Very important that they are open to questions, open to why it's not happening to me, and open to listening to answers, open to scientific answers of why things are not happening. What are all the reasons that could be leading them to subfertility, and what can be corrected, what are reversible, what can they do? For example, if they are on the higher side of the body weight, if we say that obesity is one of the reasons why they could go ahead with subfertility, and it's a reversible factor, and correcting obesity with diet and exercises would help them reduce the chances of subfertility and improve their chance of success. They do it. They do the exercises. They go ahead with the treatment per se, and they give their bit as well nowadays.
That's
so
true.
I think that's a health awareness in reproductive medicine which people have started tasting.
Which is great. And also now people are more aware, and also the prevalence definitely will increase once they are more aware. They will come for more checkups.
Exactly. Exactly. And thanks to the health awareness programs, the medical camps, the fertility camps that we do nowadays, wherein we are able to give some suggestions, we're able to counsel them, which otherwise not in a day-to-day practice of a doctor, be it a GP, be a gynecologist, when they see good number of patients in a clinic day-to-day basis, it's not possible for them to sit them down for more than 15 minutes for a patient and explain to them about what's happening to them and what are all the possibilities. So there comes this fertility counseling, which we do. And, they are able to open up, talk about not only their problems regarding fertility, but also problems which could lead to fertility, which are reversible. So that way, it definitely is helpful. And it is important for us to shift the focus rather than from straight away a medical treatment for fertility to what is the preventive strategy we could use to avoid them going in for subfertility.
That's so important. And it's great to hear that more couples are seeking help, and the stigma around fertility is being addressed. It's no longer a stigma as such, but like such a big social taboo like it used to be, I think, 20 years ago. People are coming up and talking about it and getting their regular fertility checks done. One big question that many couples have is about the choice between the treatments, whether they should go for an IUI or an IVF. They don't know. They do their own sort of research and come and sort of talk to the doctor about it. How do you decide typically which treatment is right for them?
Yes. To answer your question on the fertility taboo, there are differences when we see couple from the urban and from the suburban area. Now, during the medical camps, rural camps that we do, we come across infertile couple where the taboo still exists. There are few of them who have come out of the fertility taboo, who seek fertility as a kind of health. They see fertility as a health condition and come and approach and ask what can be done better than a natural cycle for them to conceive, and what are their problems and what scientifically could be done to have a betterment. But not all of them in the suburban areas have come out of that taboo, be it the society, be it the family around them. And a lot of health awareness is still needed in those places. While comparing it a little with the urban people, most of them have now come to terms with fertility treatments like IUI, IVF, ICSI, and all these are terms which they commonly use, just like how they differentiate a normal delivery and a cesarean section. Earlier, 2 decades ago, even a cesarean was a dreaded kind of a treatment. But now people understand that scientifically this is saving the mother and the baby. And yes, they are aware that it is a very safe procedure. Just the same way now, urban people, thanks to the health awareness which are booming on and off, they understand that it is a kind of a treatment given for the reproductive health, and that it's not harmful and the side effects are not that high. And it's something where when the nature falters, people take over and treat you. So some more work needs to be done in the suburban area, also in the urban area.
That's true.
Coming to the IUI and IVF treatments, how do we decide? How do we doctors decide? Earlier the better, lesser the better, lesser side effect profile the better. So it's a tailor-made approach that we use for every single couple who come to us. Some of them would have tried natural cycle, while some of them would not be comfortable even with the sexual activity. So we start taking a detailed history of where they stand in the fertility line. And depending on where they stand and depending on where the nature had not been helping them, we try to interfere. We try to give them medicines or in the form of tablets or injections or in the form of procedures like IUI, which is called intrauterine insemination, or IVF, or in common terms, test tube baby, or we medically call it as ICSI, intracytoplasmic sperm injection. How do these two treatments differ? Is IUI is where the tubes are okay, or at least one tube is okay. The fallopian tube of a lady is okay. She has a good egg production. She has a good uterus to continue the pregnancy. But the sperms are less in amount or in quality that it might not end up in a successful pregnancy.
Right.
So in that case, we try to give IUI. Whereas IVF is a condition where in case husband's sample is low, too low, or it's not there in the semen that he gives, though there is a production inside the testis and there is an obstruction that he's not able to give the sperms outside, then we go ahead with surgical sperm retrieval techniques. We take out the sperms from the area of production, that is the testis, and then use it, inject it into the egg of the partner, and then make it into embryos and put it back into the uterus. So technically, IUI is a simple procedure where the sperms are tested, examined, sieved, and best of the sperms go into the womb of the woman. Whereas in IVF or ICSI, the eggs are tested, the sperms are tested outside, embryos are made outside in the lab, and the embryos are put back into the womb of the woman. So this is how it's technically higher and gives a better result compared to natural and IUI cycle. It's about 5 times better than the natural or IUI cycles. But only when nature doesn't help, we go ahead with a higher treatment.
Yeah, and it's important for couples to understand also that the right treatment may vary from couple to couple. It's not a single glove fit. It's a tailor-made approach for every couple.
Correct. I even have had instances where my own patients come and ask, this is what you've done for my sister, and she's doing well now. And why don't you do the same for me? I would also conceive. But, the basic point is, do not compare yourself with another couple, because as a couple, there could be a problem in the male. There could be a problem or problems in the female. There could be as such a problem in sexual activity. To start with a fertility treatment, it's important that they don't have a sexual dysfunction. If that exists, then it is important to correct that.
Right.
And then go ahead with the treatment. Of course, if we have to shun a treatment in between because it's not going to be useful. For example, if the tubes are blocked in a lady, both the sides of the tubes are blocked and it is not possible to reverse it, then we do not go ahead with a natural or an IUI cycle. It's not indicated. So there we go ahead with IVF or ICSI, which is the treatment of choice, and simultaneously work on the sexual dysfunction if any exists.
I'm curious here, doctor. Is it challenging? Do you still find it challenging to convince couples to move forward with some kind of fertility treatments?
Yes. And most of them, when they are given counseling appropriately with the scientific facts behind, they understand and they go forward. Some of them, due to either their own experiences or because of the experiences shared to them, they try to compare themselves with those experiences and they are worried on certain facts. Some of them are worried about the injections that they have to take during the IVF. Here, I would like to re-insist that the injections which we give for IVF or ICSI nowadays are much, much painless, or I would say 80% of the pain that we used to give some few decades earlier, like, the oil injections which are given in the butt is nowadays not given. It is all self-taken injections, or it is an injection called subcutaneous ones, which are taken in the abdomen, on the tummy. And they are much, much less painful. And minimal number of injections are given, tailored approach. Like, if they need just single injection, that's enough. If they need more than one, yes, they need to be taking it. That depends upon where they stand in the fertility line.
So to convince them must be, is there resistance?
We do have psychological support and people who are counselors who are available with us. The entire team of fertility includes not only the consultant, we have clinical counselors, we have financial counselors, we have psychological counselors who, as a team, support them at all points of time. Be it a natural cycle, be it an IUI, be it an IVF, be it an advanced technique like the pre-implantation genetic testing that they have to go ahead with. And they have had miscarriages, they have had some difficulties during the IVF pregnancy or the IUI pregnancy. We handhold them. There is a team that does that.
Yeah, and it's very important for the overall support for the couple to make the right.
Exactly, because the pathway is not very easy.
It's not, yeah.
Yes, so it is very important for the whole team to actually embrace them with as much as possible, to give them so much of confidence, to give them so much of assurance. Though it's not a procedure which is 100% successful, fertility is not always successful. I have myself had people who have failed many times and then they have succeeded. I've had people who are trying yet to succeed. But there is a light at the end of the tunnel if it is properly done with a scientific background.
Yeah.
So embrace them with sympathy and empathy.
That makes so much sense, especially how emotionally taxing this whole process can be.
Yes.
First to be able to come to terms with it and then to take the fertility treatment. I think it's a big roller coaster, but I'm glad that there is a team that handholds you through the process and supports you throughout. Speaking of which, fertility treatments have also come a long way. The types and the kinds and also the advancements that have happened over the years. How has the infrastructure and technology evolved at Nova IVF?
As I told you earlier, I've been there for a decade now at Nova IVF. And what I see a decade earlier was the infrastructure which was equal to what was there internationally. And whatever was needed at that point of time, the expert lab technologies which was available, hand-holding by the experts in the world, everything was there. And as science and technology evolved, as we started having a lot of add-on technologies to try and give the best to the couple in the field of IVF or ICSI, say an embryo glue, which helps the embryo to stick on, or laser-assisted hatching, which helps the thick layered embryos to be thinned out so that they attach to the uterus earlier, and be it improving the womb of a woman who has had a previous one or more ICSI failures and now they have come up asking for further, and or people who have had some previous surgeries or medical treatments that have made their womb thinner, or they're not able to have good amount of thickness for the embryo to get attached to. We try to put in PRP. These are platelet-rich plasma. Sometimes even stem cells are usually used to improve and grow the uterus lining or the womb lining. So all these technologies which have been evolving over a decade now, we have been constantly in touch with all of those changing, improving science and technology. So I think working at Nova gives me that opportunity to explore the new things, understand that they are helpful in which group of patient, select the group of people who will actually be benefited with these techniques and people who do not need all of those.
And that's interesting how it's amazing how much innovation has impacted fertility treatments and that Nova keeps abreast with all the updates in technology. That's wonderful to hear. One question about which couples might be wondering, how long does an IVF treatment typically take? Because timeline obviously is a very big aspect.
Okay, that's a real good question. But the answer is it differs. Each couple come for the fertility treatment for different reasons. There could be a single reason or there could be more than one reasons which are leading to the subfertility. So it's important for us to ponder what is the reason, and if it is a single reason or a reversible cause, then the time towards success or having a baby or begetting a baby is going to be very, very short, as short as even 2 months. For some people who have had a long timeline even before coming to us, for example, previous IVF or ICSI failures, it's important that we plan what has to be done for them. Why have they failed? What are the factors which could be responsible leading to that failure? And then work on that and try to give them success in the upcoming cycle. So, in this case, also, the timeline of success differs, which could easily click. If it is a factor that could be corrected and we go ahead with that, then it's going to be within the next 2 months or 3 months, they're going to have their baby. In case it's a long drawn pathway for some people where it's not a reversible cause, it's irreversible, sometimes leading them to even go ahead up to bank eggs or bank embryos, bank sperms. So that is a little long process where the couple have to agree to go ahead with the third party reproduction. We do give them a lot of counseling to suggest them what are the options in front of them, what are the cafeteria that we could give as far as their factors are concerned, and then they choose the best for their, a situation socially, economically, and considering all these backgrounds.
What would typically IVF treatment timeline look like?
So typically, when they come on the day 2 or day 3 or day 4 of periods, they do some blood works that has to be done on that particular time. And they will be having a scan to assess the reserve of the woman. And we start with the injections, which may be tailored to the need of the couple. And we go ahead for about 10 days on an average with the injections, ranging from 8 to 12 days, depending on the need of the woman. And once we do a pickup, which usually sets around 12th to 14th day of the period, which is a procedure done under mild anesthesia. The woman has to sleep for a period of about 15-20 minutes.
Is it a painless procedure?
It is made painless by giving anesthesia or a sedation, which means that she has a deep sleep when the pickup is done.
Okay, got it.
So it is not going to be painful before or after the procedure. And the pain is taken off using the anesthesia during the procedure time. So that way it's going to be painless. And it's a daycare procedure. And she goes back home the same day after knowing how many eggs are collected, how many of them have been mature enough, because we see the eggs under microscope and see the quality of the eggs as well. And then we process the sample, semen sample given by the husband, and then we make sure that the sperms are of good quantity and quality, and then go ahead with the process of IVF or ICSI on the same day. And having got to know about the details of all these on the same day, the woman walks out of the recovery on the same day, because it's a daycare procedure and there is no need to stay. Hospital stay is not necessary. And after we see for about 5 to 6 days later, when the egg becomes an embryo called blastocyst on day 5 or day 6, that's a maximum implantable status of the embryo. The embryo, which is a blastocyst, is capable of attaching to the uterus the maximum. So when she gets good number of blastocysts on day 5 or day 6, we're going to either put it back into the uterus on the same cycle, which is called fresh transfer cycle. Or most of the times, if the hormones are not conducive, then we are going to store those embryos to be used in the next
cycle.
upcoming cycle if the couple are okay with it.
Got it.
So technically speaking, it might get over in a month's time, the IVF, if it's going to be a fresh transfer cycle, or the process can go up to 2 months if it's going to be a frozen embryo transfer without a gap.
But ultimately, there's no timeline for any IVF treatment because treatments are different for every couple.
Correct. And as far as the success is concerned, the timeline is not defined. But as far as the procedure is concerned, it's a defined timeline.
That's true. That's a great explanation, doctor. And for those who are going through IVF or undergoing the process or the treatment, what precautions do you advise after embryo transfer?
There are a lot of questions after embryo transfer. There are even questions which says, can I eat this vegetable? Can I eat the particular fruit? Will that harm me? Will that harm the baby? A lot of anxiety crops up at that point because they try to give their best.
Yeah, because it's after such a long time, they've gone through the whole process. They want to make sure that nothing goes wrong
from their side.
So,
exactly.
So from the doctor's perspective, what do you think? Is there anything that they can do to help their chances to be better?
Yes. First thing, avoid anxiety. Please be normal. Because it's not what you are going to do. It's what the nature is supposed to be doing to you after all these medical treatment. So stay calm is the first advice that I give my patients. Stay calm, stay relaxed. Whatever we could do from our side, we've done, both the patient and the doctor for that reason. And what has to be done now is just the implantation, which is attachment of the good growing blastocyst or the embryo, which needs to get attached to the lining of the womb, which is already prepared. So stay calm, relax, hydrate yourself well. It's important that you nurture yourself at this point of time to the maximum. Take good amount of vegetables and fruits. Take foods that help you, stay calm. Add a little bit of, healthy snacks in between. Take care of yourself. Keep yourself in the best maximum healthy condition, at the pink of health, if I can say that. And make sure that you take the medicines regularly at the prescribed time. Do not miss tablet. If you have any kind of adverse effect, it is always possible that people connect any adversities that is happening to the medicine or the procedure, if a procedure is done or if they're taking some medicine. So if you have any doubt if you have to continue the medicine, please call up your doctor. Please stay in touch with your doctor or the team and take their guidance before you go ahead. And do not stop the medicines, because these IVF medications are all hormone medications which are given in the minimal amount that is necessary. So stopping that would actually sometimes do more harm. So it's important to convey that you're stopping or you're having some side effects or adverse effects. However simple the question would be, please ask us, ask the team and get a clarity. Then you can go ahead with whatever is suggested to you. And we also handhold them around that 14 days of time, 2 weeks time from the time of embryo transfer to the blood test, becoming either positive or negative. There are a lot of emotional roller coaster that the lady goes through.
I'm sure.
Not only she, but also the partner, not only both the partners, but also the family, which supports them. So I tell them to be relaxed. I ask my counselor to talk to them at the end of a week and just before the blood test is done, to calm them down, to make them understand that this is going to be either positive or negative. And whatever it is, we are going to go through the process until it becomes positive. If it's positive, yes, we are going to enjoy that as a team. So this actually helps them to understand, okay, it's not only me and my family, but there's a team which is going to support me, whether it is positive or negative. And yes, I know what the science behind this is. Yes, I'm going to give it a try. And that positive mindset, believe me, has helped many people. If they become positive,
to enjoy that further.
Yes. And if they become negative, to take it up further and go through the process with strength.
Yeah, I think the reality check is also very important, that it could be an either, the probability is for either or, right?
Yes.
It could be a positive or a negative. So I think that's also very important. But that's really practical advice, doctor, that helps, especially during such a crucial stage of treatment. When it comes to choosing an IVF center, what should couples actually look for? They have the science at their fingertips, they understand the concepts, they know the technology is available to them, but how should a couple actually narrow down to a IVF center?
It's important to handhold them when they try and check on which center should they submit themselves for the procedure.
How do you think they should actually go about it? What are the important things that a couple should actually look for while choosing an IVF center?
The center, number of years that the center has been doing a good job, how authentic the center is, and how good has its reputation be. And of course, the stories of people who have gotten treatment there, the people in the support groups who are actually the previous patients, who give us an idea that, how the center has treated them, how good they were able to achieve successes. All these have to be checked. And it is important to know your doctor, important to know what your doctor's qualification is and what she has done so far, how many couples have been benefited because of your doctor and her team or his team. So all these comes to,
It's important.
It's important to know all these to determine where you're going to get treated.
And it's reassuring that to hear that every couple that will come will get a personalized care. Every couple that
Absolutely.
comes,
At least
is
I can
not-
say at Nova, yes, we do have that personalized approach to each and every couple. The treatment differs, the couple differ, the problems differ, the success rate differs. So it's important to personalize them. Simply, not a single treatment fits everybody. So it's important to tailor.
But what happens when a couple comes with IVF failures? Because how do you help them cope with the disappointment? And what's your advice for those who have experienced multiple failures? Because that's also like a big thing that they come with, like that trauma or baggage.
Absolutely, yes. Because fertility pathway by itself is not easy, as we spoke. Now here they have a lot of frustration because they have spent money, their time. They've kept this as their foremost important, factor.
Priority in life, yeah.
Exactly. And they have actually sidelined everything else. So when you bid on something and you don't get it, you lost your money. It's the same kind of frustration and the emotion that they go through when they have a negative result. So this feeling is something which we have to tackle with the counseling team. And then we go through why they have gone through this negative result. What is the reason? Apart from the routine implantation failure, which could get corrected automatically in 2 to 3 transfers, is there anything else that needs correction? Is there anything else beyond the normal IVF or ICSI care? Any advanced, innovative add-on procedures is necessary to find out where the problem is and use them appropriately, selected approach, tailoring to that particular couple, personalized care will obviously take them through the success line.
Yeah. And I think it's also very important for them to stay resilient through this.
Thanks to the
time.
team. Thanks to the team that we work with at Nova, the counselors actually sit through the whole process, whether it's clinically an IVF or an ICSI, which has to be explained to them, the pathway that they would go through, the kind of nutrition that they need to take, the kind of exercises, even if they don't hit the gym, going ahead with walking daily, making it their second routine. These are all spoken to them in detail. The counseling sessions take at least 30 to 40 minutes.
It's important, right?
Yes, because that gives them a feel that they are cared for personally and they are able to understand these are all certain things which could make a change when they try next. And they do understand scientific basis of why a failure has happened and what can be done to correct. And of course, there are some reasons which cannot be corrected and what can be done to overcome that failure. So
that's very important. And thanks for putting it like that, because a team is very important that to take you through that emotionally. On a personalized note here, as you've been an academician, let's talk about the next generation of doctors who are there. What would be your advice to those aspiring to specialize in infertility medicine?
they are welcome. It's fertility medicine is a blooming sector now because it has
As sad as
its
it
own-
is, infertility as a
Truly.
problem.
Truly sad in a perspective that they have to spend more time and money on it and a lot of frustrations if they don't conceive as early as the other couple do. But we are happy that we are able to help such couples.
Yes.
We are able to get into depth of what their problem is and try to correct it as much as possible.
True.
We are able to fit ourselves into their shoes and see where they stand and help them with the medical knowledge that we have, along with an empathy that we could actually relate them to with. So I think I personally, I'm really super happy to be, in this field, and I'm blessed to be in this field to help a lot of couple who we have been helping through the decades. And with improving science and technology, I'm happy that I'm able to give a little better result for those people who have had previous failures, even with me some 5 years, 6 years ago. So that way, I'm really, really looking forward for much of the treatment strategies that are coming up, the scientific improvements that are coming up, to be able to put that into use for my patients. So
Yeah.
I think To the aspiring doctors, yes, it is a good field to have, to people who have a good visionary to help people who are childless and to help them through their difficult times, like, not only for IVF failures, but also for people who in their reproductive age group are suffering with cancers, who in their reproductive age group have to undergo some chemotherapeutic medications because of some problem like connective tissue disorder, or people who have to undergo removal of the ovary because of some conditions like endometriosis, or because the ovary has undergone a twist or torsion, which is an emergency, or for people who have divorced or who are single people who want to have their own baby. So all these kind of people are also able to be helped.
That's wonderful advice for people that who are looking to it, that there's more than you scratch the surface. Doctor, you've worked extensively in oncofertility. Can you tell me a little bit about it? What is oncofertility? What all does it entail? And the certain aspects that are related to oncofertility, and how does it actually help to a person who is has gone through cancer or is going through cancer treatments?
Oncofertility is actually a subspecialty of reproductive medicine where we have people who have been diagnosed to have cancer in the pre-reproductive age group or in the reproductive age group to be able to have their own gametes, their own sperms in case of men and eggs in case of women, or embryos in case of a couple, to be frozen for later use. They have their own biological gametes frozen for future use. Thanks to innovative technologies in onco treatment, in cancer treatment, we have a lot of drugs which have come up. We have a lot of surgeries which have come up. Robotic surgeries, for instance. These have all been able to clear the cancer and give them an increased survival period, and they go through the reproductive age group. And such increased survival rate, as far as the cancer patients are concerned, they are devoid of cancer at some particular point, and they enter into the end of reproductive age group when they have their own biological gametes to give them a baby. That's a fantastic feeling. Instead of going ahead with, of course, there is a second strata in case they do not have their own gametes to freeze, or they have gone through cancer treatment and now they can't freeze their own gametes. They can go ahead with third-party reproduction, as we call. Donated eggs can be taken from the ART banks, donated sperms or donated embryos as such. But having their own biological gametes is still possible. That field is oncofertility. And just like oncofertility, for people who want to push their pregnancy or childbirth a little later, be it carrier or because of the marriage or because of their growth in the profession that they want to postpone their childbirth, they can do that by socially freezing their egg or sperm, or by freezing the embryo, especially for women who's career oriented. She can actually store her gametes, egg freezing, the social egg freezing, or she can actually store it as embryos if she has a partner or the husband. And this is usually useful for people in and around that 35 years of age, which is like, cat on the wall. We never know how much is the ovarian reserve that she's going to have after 2 or 3 years when she'll actually be okay to go ahead with a pregnancy. In case, for instance, she is 34 now, and by the time she tries conceiving, she's 37 or 38. Her ovarian reserve could be on an average right now, which could fall down below the normal during that particular point where she misses the bus. Yeah. So it's important to guide them. And this is an elective procedure. It is not a procedure which is an emergency or an urgency cater. So obviously, it's important to counsel them and to have an awareness about this, also helping them in their career growth.
Got it. This has been a great conversation, Doctor. Could you tell us a little bit about your case studies, some of the stories that have actually had an impact in your life and had made you reaffirm your choice of profession? That will be our last question to you, to understand what keeps you going.
The success that we give to infertile couple definitely rings a bell, and obviously reaffirms that, we are in the right track. So that's a positive energy that we gain. And this has been happening for more than a decade here, and I'm happy to have that. Now, to share these stories, these are real time stories. And apart from the routine IVFs, IUIs, and the natural cycles, which we have helped thousands of people with, there are some people who have suffered with cancer, who have been, their gametes have been stored before they went in for the cancer treatment, be it chemotherapy or a radiotherapy. And they have come back and had their babies, and they are having their babies now.
Wow.
And it's really heartwarming to see the mother and the baby together after a long, tired journey.
Yeah.
Yes. And coming to this is a kind of heartwarming situation that we see after onco-fertility treatments. In case of people who have stored their eggs frozen before their marriage when they are around 35 years of age, particularly some of them were medical professionals, and they, having tried naturally, some of them have conceived on their own and they don't need that socially frozen eggs as well. But some of them have come back either for their second baby or even for the first baby when they didn't conceive naturally. And this egg, which was frozen for more than 5 to 7 years, have been of use to them when they didn't have the nature helping them. So, and for people who have had severe endometriosis, which is a kind of, a medical condition where repeated surgeries would be needed, and it crops up again and again. And people with severe endometriosis take a toll on their quality of the eggs, the quantity of the eggs, all these get diminished. And even at less than 30 years of age, such people have very, very diminished ovarian reserve. So storing their eggs have also helped them when they go ahead, get married, and have their babies. And we've had cases where men who couldn't actually perform, sexual dysfunctions have been there. They have been treated, because seeing a lady doctor, most of them usually think, okay, I need a male doctor to say my sexual dysfunctions and get them corrected. It's not so. We've been trained to do both male and the female fertility issues could be sorted out. So it's good to see men open up their problems, get that sorted with medications or with surgical sperm retrieval techniques, the surgeries, and have their own babies. And such real stories also exist. And thanks to the support group, we have a patient support group, people who have conceived with us after a very long, hard journey. These people actually are willing to help us, and they tell their stories. They talk to our present patients, tell them that we've had a light at the end of the tunnel.
And it's very important to have that community to talk about your fears and your
thanks
problems.
to all the patients who've been helping me to do that with my present patients. That's been really
lovely.
wonderful to handhold them, not only from the clinical perspective, but also psychological perspective.
And what would be the scope of fertility treatments in the world? I mean, what do you think it can open so many avenues for so many people? What
As
do you
we
think
have
about
spoken
that?
about, there are a lot of avenues that have been opened up by fertility treatments, right from storing their gametes for future use, people who are not married, people who are married but yet not ready for pregnancy. Starting from there, as far as the onco-fertility is concerned, storing theirs once they get to know that they have a dreaded disease to treat first, or people who are navigating through the 35, 40 years of age when they have to store it for their second baby, for example. So all these are avenues which the fertility treatments have paved. And to say, even people who have gotten divorced, who have had previous marriages where they have tied their tubes because they do not want further babies. They have had babies in the first marriage and now are in the second marriage and now would like to have a baby out of this marriage. Still, IVF is going to help them, even if their tubes are not reversible, even if they have not been successful with the tubal reversal procedure. And the sterilization reversal is a procedure which has its own disadvantages, and it has lesser rate of success after sterilization reversal. These people can actually get benefited with IVF. So there are many avenues which IVF opens up, the fertility treatment opens up for the couple. And it is important to have a one-to-one conversation with a couple to actually give them a personalized care. give them a strategic plan of what they can do to achieve success in the shortest possible time.
That's wonderful to know, doctor. And that's why through these mediums and through Fertility Tales, we urge people to get their assessments done, to navigate and to understand how to tread that path to parenthood better. Thank you so much for your insights, and thank you for being here today.
Absolutely. Thank you so much for being a good interviewer who nudged me to say all the very important points there. And, thanks to the team and wishes to all the lovely couples who've been
Thank
trying.
you so much, doctor.
Thank you.
And to all our listeners out there, if you're considering fertility treatments or just want to know more, don't hesitate to reach out to Nova IVF. Thank you for tuning into Fertility Tales, and we'll be back with more stories, expert insights on the road to parenthood. Take care, everyone, and don't forget to like, share, and subscribe, and spread the word. This is your host, Simrat, signing off.